pregnancy, the mother-infant relationship before birth and why it matters. Good afternoon, ladies and gentlemen. Today I feel proud and privileged for getting an opportunity to speak before this learned August gathering. Today, we are going to delve into the extraordinary dad that forms during pregnancy. The mother-infant dad during pregnancy is a dynamic reciprocal relationship that shapes the developing fetus in profound ways. Over the next 14 minutes, we'll explore the research and insights into mother's infant diet during pregnancy. By understanding the critical role of the mother-infant relationship before birth, we can better support expectant mothers, promote healthy fetal development, and foster a lifelong foundation for physical, emotional, and social well-being. Now, going to the overview of my presentation. The fetus is hidden yet receptive. There is a transmission of maternal emotion to the fetus, and this is the time of prime opportunity for early intervention and prevention. Hidden yet receptive fetus. We all know that the fetus is rather hard to be accessible. However, the fetus experiences the mother's life. The fetus is perceiving all aspects of her mother's life and is also affected by it. That means fetus is getting associated with the mother in uterus. Therefore, fetus is experiencing, perceiving, and is making association with mother's experience from inside the uterus, therefore learning the same. I am going to give a few examples of fetus retaining maternal experience. Newborns suck more to the scent, preferably to their mother's breast, as compared to other scents based on the continuity between the olfactory smell cues in the amniotic fluid environment to the scent of mother in the amniotic fluid. Fetus registering maternal experience. Newborns suck more, and preferably when they hear the voice of their mother, a tape recording of their mother's voice versus a stranger's voice as per Dr. Swiss. This is because the fetus is exposed to mother's voice for 9 months, which is the building block in their relationship. Fetus registering maternal experience. There is a biological connection of fetus and mother. Pregnant women who exercise have fetus with healthier heart rate pattern. Their babies have a better cardiovascular system and neurological system. They have better heart rate pattern even before birth. Now, I am going to be talking today about maternal emotional experience. They too seem to affect the fetus before birth with implication in fetus or child personality development. To start with, I am going to be talking today about maternal emotional experiences. They too seem to affect the fetus before birth with implication in fetus or child personality development. To start with, I am going to tell about a study done back in the year 1967 by Cooper and Hughes. The pregnant women coming to their lab were told that they were breathing a gas which has only half of oxygen required for the sustaining of fetal life, but that her normal body mechanism would probably compensate for their altered environmental condition. This created an acute stress experience for the women, and this is a dreadful thing to be told anytime during pregnancy, and here it is in the late pregnancy stage. And what happened, you can see in the top is the maternal heart rate, and in the bottom panel shows the fetal heart rate pattern. After psychic stimulation, that is the induction of stress, and here you can see the maternal heart rate went up, so also the fetal heart rate also went up. The mother's heart rate went up due to body's response to flight and fright, but the fetal heart rate also went up coincidentally when mother is having an emotional experience. Hence, here the fetus registers mother's emotional experiences, which is seen clearly over here. Now, let me explain the mechanism of this experience. One possible idea is a stress hormone called cortisol and development, and this was beautifully summarized in Times magazine several years ago. This is the phrase to remember how the first 9 months shapes the rest of your life. Now, let us discuss what about stress? Toxic stress or chronic stress, anxiety and or depression the woman is feeling during pregnancy, influencing the future child's neurohumoral behavioral development that affects the child's brain and normal development. This is a paper on antenatal anxiety and behavioral or emotional problem in children by Thomas O'Connor on 4,000 children of UK aged 6 to 7 years. In this study, it is seen that women having toxic stress, antenatal anxiety or more prenatal anxiety, the children of these women at the age of 6 or 7 will have attention hyperactivity disorders, emotional problems and conduct problem. The published article of attention in amygdala prefrontal circuits in infants exposed to prenatal maternal depression, they have taken a sleeping newborn infant for magnetic resonance in their brain imaging and functional connectivity of different part of their brain when they were in sleep, that is in the resting state. It is seen that a greater connectivity between amygdala, which is a part of limbic system or emotional brain, and the frontal cortex, which is oriented to higher cognitive processes. There are greater connectivity in this brain who are exposed to a study by Catherine Mong from Columbia University in give biological signal and fetal movement and fetal heart rate was noted. And this is a graph. This is a graph of fetal data for fetal responses during maternal stress. In her lab, a stress was given which was not a life-threatening threat. They did a cognitive challenge test which is called a SCOOP test. First, they learn about the mother who they are and the level of toxic stress in their life. So they go through a psychiatric interview and then given toxic stress. It has been seen that babies who have been exposed to toxic stress, they have greater connectivity. Their amygdala has a greater connectivity to response to dangerous signal in the world. They are fetuses who had heart rate increased, whose mothers had undergone stress in the lab. Even the features are very reactive to the signals coming their way, and their brain have greater connectivity in amygdala, anticipating danger potentially. They are more vigilant to react to the signal that is coming their way. Now, let us analyze the studies. Was this behavior have some relationship with behavior of baby once they are outside the womb? It was categorized by the temperament and their motor activity and cry reactivity and how their brain reacting and responding to stimuli that is coming on their way. This is a paper done by Elizabeth A. Werner and Catherine Mong, prenatal predictions of infant temperament. Data showed that prenatal factors influence temperament of children. In 50 dyads, they examined fetal heart rate activity and women's antenatal psychiatric illnesses as prediction of infant temperament in 4 births. This paper showed that fetus who were reactive to mother's stress experience, they are more prone reactive at 4 months old. Now the question arises, how does maternal emotional stress is transmitted to the fetal temperament and shape their behavioral pattern and brain development? So as you can see, maternal toxic stress with mediating signal in utero environment which has altered fetal development and then the child risk of psychopathology. So we have explained that toxic stress having role in child's behavioral development, which is often due to dysregulation of stress hormones cortisol called glucocorticoid hormones. In this paper, again by Catherine Mong and others, alteration in placenta, there is a pathway by which maternal experience is getting into fetus called HST11 beta, which generates an enzyme that differentiates how much cortisol has to be secreted that affects the fetus. When this gene is functioning well, it deactivates control across the placenta. It was found that greater the toxic stress, more is the epigenetic process that genes are turned off. It is seen in animal studies more. Cortisol is getting into uterus, and in that studies found that fetal behavior was altered, that is detrimental in development in CNS in these features. So finally, this dietetic relationship in pregnancy is finally a prime opportunity for early intervention for both pregnant women and her future child. Now, I have shown you that the data that I think I have convinced you that brain development begins even before birth, and we have a relationship between mother's emotion and fetal behavior. So fetus registers and is shaped by maternal experience via biological transmission or communication. We talked about maternal scent, maternal voice, cardiovascular regulation in the fetus associated with mother's exercising. How toxic stress and depression impacts the child brain development. So baby is in mother's mind and heart long before birth. So also there is a psychological relationship developing much before the baby is born. How the mother holds the baby. How much time am I having?
Ma'am, you have 2 minutes.
Okay. With this in mind, again study was done by Elizabeth Werner, an intervention based on conceptualization of postpartum depression that was an approach through preventive psychological and behavioral changes in the mother that her and the child even before birth is postpartum depression. Prenatal toxic stress is the change factor for postpartum depression, which is 10 to 15% in an average population. But there is poverty, and in very adverse condition of postpartum depression rise up to 40%. So we all agree that this has a deleterious effects on the mother and child relationship. So PrEP practically is the resource for effective postpartum parenting, is a bidirectional method of psychoeducation for the mother. PrEP intervention starts before birth based on the assumption that stress reduction will improve infant temperament and in turn the capacity of the mother to take care of her child. PrEP reduced the rate of severe postpartum depression, which is more than 40% to less than 20%. So to wrap up with beyond shared genes interacting with the postnatal environment, there is a possible third pathway by which toxic stress affects children's development via mother mental health during pregnancy. Depression, stress, anxiety are typically modifiable factors when there is access to decent behavioral health care. We can help pregnant postpartum women, and by doing so help the next generation. Thank you.